So there's a new study that exposes the American healthcare system for the scam that we all know that it is. So, of course, as we continuously still to this day endure the effects of a rampant virus, while we're still undergoing what it means to be in a pandemic, a new study was published, and the title is the following, and you'll get all you need simply from the title. Universal healthcare could have saved more than 330,000 U.S. lives during COVID. Now, as we have heard from our elected quote-unquote leaders in our government, they have basically tried it out an entire assortment of solutions to combat this disease, COVID, to combat the virus, and to get us quote-unquote back to normal, as they have been quoted saying on so many different occasions. And they have gave us solutions such as the following. You gotta stay home. If only you would wear a mask. Go get vaccinated. Now, I am not assailing against any of those things. I don't really think that any of our opinion regarding those things, those different methods, those different solutions, if I may, really matters in the context of this video. But what does matter is the overarching solution that has to do with the huge problem in this country, and that problem is indeed people's access to adequate healthcare. So I'm going to read you a little bit of what this study has to say, and then I'll wrap this up. Americans spend more on healthcare than people in any other nation, yet in any given year, the piecemeal nature of the American medical insurance system causes many preventable deaths and unnecessary costs. Not surprisingly, COVID-19 only exacerbated this already dire public health issue, as evidenced by the U.S.'s elevated mortality compared with that of other high-income countries. A new study quantifies the severity of the impact of the pandemic on Americans who did not have access to health insurance, according to findings published on Monday on Proceedings of the National Academy of Sciences of USA. From the pandemic's beginning until mid-March 2022, universal healthcare could have saved more than 338,000 lives from COVID-19 alone. The U.S. also could have saved $105.6 billion in healthcare costs associated with hospitalizations from the disease, on top of the estimated $438 billion that could be saved in a non-pandemic year. Healthcare reform is long overdue in the U.S., and says the study lead author Allison Galvani, director of the Center for Infectious Disease Modeling and Analysis at the Yale School of Public Health. Americans are needlessly losing lives and money. People who do not have insurance usually do not have a primary care doctor, which means they are more likely to suffer from preventable diseases such as type 2 diabetes. They also tend to wait longer to see a doctor when they fall ill. These two factors already contribute to higher mortality rates in non-pandemic years, and they compounded the impacts of COVID-19. Comorbidities exacerbate the risk of disease, and waiting to seek care increases the likelihood of transmission to other people. Prior to the pandemic, 28 million American adults were uninsured, and 9 million more lost their insurance as a result of unemployment because of COVID-19. Many Americans feel secure in having good health insurance from their employer, but employer-based insurance can be cut off when it is needed most, Galvani points out. Now, I also do think that it is relevant to say that other experts have said that that number is undercounted, maybe even severely undercounted. And of course, as I read there in that brief outlining of the report, that wasn't the report itself, but it was kind of an overview. You know, people also say that the number of people in this country that don't have health care, that are uninsured, that can't pay for their health care, is also severely undercounted. And I believe that as well. But what I want to do is I want to give you a couple more extremely interesting facts, this time from the study itself. So this is a previously calculated interesting fact. So if we had universal health care, we would have saved over 68,000 lives in the year 2017 and 76,000 lives in the year 2019. And the study also goes on to say that while single-payer health care is paramount to addressing health disparities in the United States, the challenge is multifactorial. Pervasive inequities regarding income, education, and housing impact nutrition. mental health, exposure to pollution, and feasibility of accessing healthcare services, paid sick leave, nutritional programs, and affordable housing are among initiatives that are necessary to alleviate disease burdens overall and mitigate systemic gaps in health. So I wanted to give you that little quick caveat there, because it isn't just all about single-payer universal healthcare, which should be a goal, but it isn't the goal. Like, it isn't the end-all, be-all. Of course, that is completely mandatory, and it's one of the most damning things about living in America, the fact that we have such a insanely rapacious, for-profit, corrupt healthcare system that, I mean, can hardly even refer to it as healthcare because so many people don't have healthcare. But this study, in a nutshell, essentially exposes one of the many, many internal contradictions of the American society and of our economic system. You know, the way I like to think about it is the only people that struggle from these types of decisions, such as having an insanely corrupted for-profit healthcare system, is the population of America. Nobody else is hurt by this. Russia isn't hurt by this. China isn't hurt by this. The people in Iran don't suffer because Americans have to pay the highest amount of costs and receive mediocre care at best. No, Americans suffer. They're dropping like flies from COVID. Over 330,000 of them could be saved. Year after year after year, tens of thousands of people can be saved from having either healthcare, period, or adequate healthcare, access to healthcare, to which they don't go into extreme amounts of debt for seeking care, because many people that don't have insurance won't go seek care because they can't pay for it, because it costs an arm and a leg and they won't be able to pay the debt back. You know, it's one of the, you know, the debt gods that run this country. You know, you have healthcare debt or medical debt, you have student loan debt, you got the credit card debt, and you got mortgage debt. You know, the four gods that reign over America and basically rule all the laws of the land in this country. But this is no secret why this is going on. You know, I always say we have a military industrial complex, because we do, and it's entirely true. President Eisenhower said it probably the best. But I see other people, and it's only a few of them, because a lot of people don't like to make the like to equate the two. But there's also a medical industrial complex in which Big Pharma, the health insurance companies, and, you know, the help of some doctors, they basically run the system the way it is, and like literally to the tunes of millions of people suffer. But compared to those millions, a very small collection of people are able to profit and get money off of it and thrive. And not only that, but they have bought our entire political system. Big Pharma and health insurance industries, they are funding both parties, Republicans and Democrats alike. This isn't a particular issue that's thrust upon one party or the other. Of course, there's differences, but there's way more similarities than any difference in this regard. Neither party is fighting for healthcare for all, for you or me or anybody that needs it, okay? But as I expressed, this is another internal contradiction that Americans will continue to suffer from. And it's quite distasteful and just horrendous display of the carelessness and overall corruption that plagues this country.